Hey there, I'm Dr. Laura Paris. I'm a practitioner of Chinese medicine and functional medicine. And this video is specifically to explain the process of working with me doing functional medicine. So it's different now because of COVID times. So typically I work with women via telemedicine on video across the United States, and I've been doing that for some years. And I also see women locally at my clinic in Monterey, California, and then across the bay at another clinic in Santa Cruz, California. But now that it's COVID, to be safe, I'm doing all my functional medicine appointments on Zoom so that we can see each other face to face and not wear masks. So the process of working with me is that you start by booking a new patient appointment, and you can do that yourself online. And at that appointment, we go over your intake form and your history and your health concerns and goals. And then we decide at that appointment if we want to collect more data. If you have current labs, you upload them with your intake, and then we decide what else do we want to collect. I'm pretty good at being very judicial about what data would be very important to collect, and very honest about my recommendations. So the most common 3 labs that I do are blood work, which you can do at your local lab using your insurance. And then the second most common, is probably the Dutch complete hormone test, which includes reproductive hormones and how they metabolize, and also adrenals. And then the third most common test is the GI map, which is a comprehensive digestive analysis and DNA-based analysis of your microbiome. So that's both of those, the Dutch hormone test and the GI map, are not things that you're going to get at your conventional doctor's office. They're definitely outside the box of conventional medicine, and they're pretty sophisticated in terms of the information we get. I may also want you to collect your own data. I may want you to test your blood sugar or keep a journal of how you feel based on dietary changes. Perhaps take your basal body temperature, especially if you're a woman working on fertility or improving your cycle, regulating your cycle. And I love collecting pictures of tongues, because in Chinese medicine we do diagnosis partly based on looking at tongues. So after the appointment, your investment in the appointment includes my time coming up with a written treatment plan for you that's very specific and very clear. And it usually contains bite-sized steps that are appropriate for you. Some people like to make big changes, some people like to make slow changes. And the changes and treatment plan will include definitely nutrition. I have a strong background in nutrition, and I'm a firm believer in food as medicine. We definitely are what we eat, so I apply that in every treatment plan. There is no one-size-fits-all type of nutrition as well, so I very much customize that to the individual and what goals we're trying to accomplish. And then I may give some other lifestyle homework, which could include changing the way that you manage your stress, or your sleeping habits and timing, or the types of movement you do. I'm often providing some therapeutic movement exercises. And then therapeutic herbal medicine and supplements are always included if appropriate. So you have, after the appointment, you have your homework and your jobs to do, and you're completing labs. And we can message each other on my patient portal if you have questions or feedback. And then at your follow-up appointment, which can be 30 minutes or an hour, depending on how much time we need, we go over all the new data that we've collected. So both with labs and also with what you're doing on your own, how you're feeling on the treatment plan, and any journals you're keeping. And we go over that, and then we hone in on your treatment plan and make it even more specific and modify it based on the first round of information that we've collected. And then we just continue that follow-up appointments, honing in on the treatment plan and making modifications until your goals are met. So how long does this take and how often are your appointments? So typically appointments are once a month. However, people who have more complex things going on sometimes see me more often. Again, appointments are 30 minutes or an hour depending on how much time we need, but they all include my time later writing up a treatment plan with you, for you, I mean. And then, we always, if we need to reorder labs or order new labs, we do so. So how long it takes, the process, it's, in a way, it's like therapy, but for your body. And you do it for as long as you need to until you're satisfied and your goals have been met. So until you've worked through what you came in for. So if you have a really long-standing issue that's been going on for 10 years or for your whole life since childhood, that of course is going to take longer than something that is newer in your life. So it kind of depends on how many layers we have to unravel. It could be anywhere from a couple months, could be anywhere up to a couple of years. So it really depends on your particular situation. And then what are we actually doing in functional medicine is we are always seeking to find the root cause of your symptoms. So we're looking at underlying body systems like detox and digestion and hormone balance and blood sugar balance to assess what is out of whack and what we can do about it so that you can resolve these symptoms and feel better. So a common story I hear is people come in and they say, I'm tired of feeling this way and not having answers from my regular doctor. So I'm ready to step outside and I've discovered functional medicine. The philosophy makes sense to me and I want to understand what's going on. I'm not satisfied with conventional. And that's pretty typical of the kind of people I take on. And some women are highly educated in terms of they've listened to a lot of podcasts, they've read a lot of blogs, they've maybe self-diagnosed, maybe even for years, tried lots of things, and they just want an expert to help them put the pieces together. And then other people are maybe newer to functional medicine and have never heard of it before, and they still want help putting the pieces together, but they have less background experience. And I welcome all types, and that's it. So if you're interested in exploring functional medicine with me, but you're not totally sure or ready to book, I strongly invite you to book a discovery call. So I offer complimentary 15-minute discovery calls where we can hop on Zoom and meet each other face to face and see if we're a right match. And I can let you know very honestly if what you're coming in for I have experience with and if I can help and what that would generally look like, the process. We don't get into diagnosis and treatment in the discovery call, but we can definitely see if we're a fit and see if I can help you. So I invite you to start with that. I think it's a great idea. However, if you've looked over my information about what I specialize in and you're ready to book an appointment and you don't want to wait to do a discovery call, you're welcome to book a new patient appointment immediately. All right, so that pretty much covers it. Thank you so much for listening to this and watching, and have a great rest of your day.